My name is Aita Susi. I used to be a pediatrician, and now I'm a child and adolescent psychiatrist, and I work with families and children in the area of ADHD. So I thought the first thing that we would do is start off with a history of ADHD. Many people seem to believe that it's a recent diagnosis and it really doesn't count because, it's something newfangled and doesn't have a basis in history. Yet, there are examples of ADHD showing up in medicine as early as 1798. There was a Scottish physician by the name of Sir Alexander Crichton, and he talked about people who have the incapacity of attending with a necessary degree of constancy to any one object. Sounds like inattention to me. About 50 years later, Dr. Heinrich Hoffmann he's German, came up with this series of books called Struwwelpeter, or translated into English, Slovenly Peter. And this series of books had characters like Fidgety Phil and Harry who looks in the air. All right, so we have inattention and we have hyperactivity already in children's books. And this guy didn't like cutting his fingernails and doing his hair and, doing boring things like that. Then in the early 1900s, 1902, there was a doctor, a pediatrician by the name of George Still, and that is his true name, who also spoke about inattention and hyperactivity. He described ADHD with specific details, and he's the first one to have really done that, and he's accredited for kind of starting the history of formal ADHD. ADHD became a formal diagnosis in 1968, and then it was called the hyperkinetic reaction of childhood. And the name seems to change every time we come up with a new manual for physicians. Sometimes ADD, sometimes ADHD, sometimes with this, without that, but the general condition involves inattention and hyperactivity. So I guess I should say what the letters stand for, though most of us, I believe, already know. ADHD stands for Attention Deficit Hyperactivity Disorder, and has two basic components, the inattention aspect and the hyperactivity aspect. Some people have both aspects, some people only one or the other.